So today we are going to be talking about pediatric burns. Skin is the structure and barrier that protects our bodies against the environment, such as the sun, chemicals, and bacteria. It also helps regulate the moisture and temperature in our bodies with receptors to indicate touch, pressure, pain, and temperature. When a burn occurs, the skin is damaged and various systems can be affected, which can have extensive physical and psychological implications, as our skin's appearance contributes largely to body image and social acceptance. 25% of all burn injuries occur in children under the age of 16, with a majority under the age of 5. The majority of pediatric burns are caused by scald injury, fire injury, and child abuse. Burns are classified based on the size, depth, location, and total body surface area involved. In children, the head and neck comprise 8.5% of the body's total surface area, and in infants, it is 18%, whereas adults, it is only 4.5%. Which means that burns of the head and neck of children and infants are much more severe than for adults. Most burn injuries are minor and do not require hospital admission, but many are serious and require transfer to a burn center. Large burn injuries often affect multiple organ systems, including cardiovascular, respiratory, gastrointestinal, renal, hepatic, and neuromuscular systems. The presentation of a burn depends on the depth, of which there are 5 levels. Superficial burns can be from a sunburn or brief exposure to hot liquids and present red and dry with no blisters and short-term moderate pain. Superficial partial thickness burns can be from a severe sunburn, prolonged exposure to hot liquids, or brief contact with hot metal, and this appears wet with blisters and significant pain. Deep partial thickness burns can be from flames, prolonged contact with hot metal, or liquids, and this presents with large, broken blisters with hair still intact. Full thickness burns occur from extreme heat or prolonged exposure to heat, hot objects, or chemicals, and appear pale, non-blanching, and with no sensation to light touch. Surgical intervention is often indicated. Subdermal burns occur with electrical burns and severe long duration to heat, which presents with hot charring and exposed muscle or bone. Surgical interventions are indicated. Depending on the location and severity of the burn, many occupations will be affected due to pain, range of motion, and psychological effects. This includes sleeping, eating, playing, school participation, mobility, dressing, and bathing. Post-recovery, social interaction and ADLs could be affected if left with scarring or contractures. Depending on the severity, a child may have to undergo surgery such as excisions and skin grafting to prevent sepsis, hydrotherapy to remove loose debris, fluid replenishment, which is very important in the acute phase, and nutritional therapy. After stabilization, they will have wound management, and OT may address pain management, positioning and splinting to prevent contractures, stress management and psychosocial support, compression therapy for skin conditioning, scar massage, therapeutic exercise and activity tolerance to promote ADL function and prevent loss of range of motion and strength, and family education. The therapy team will be very important and include OT, PT, speech, recreational therapy, respiratory therapy, orthotists, nutritionists, and psychologists. Go team!